What are the things to look for in formula milk?
Formula milk is a trap. Mother's milk digests very easily and baby gets hungry fast.
Why should we avoid packaged ORS?
ORS means only WHO recommended formula ORS. You can't use ORS. You can't sell any other drink in the pharmacies.
How are milk mixes and gummies harmful?
This is going to have lifelong impact on your children.
Ma'am, say something about autism and vaccination and why that myth should absolutely not exist.
Please don't throw your money to them. It is not even legal at this point.
People sometimes argue that, oh, you're charging so much fees for just 5 minutes of your time.
My fee is my prerogative. I'm not sitting here to provide affordable healthcare to everyone.
A lot of people feel that if you have small breasts, you cannot breastfeed.
Yes.
Hi and welcome to Decoding Health. In this episode today, we have Dr. Sivaranjani Santosh, who is a senior pediatrician practicing in Hyderabad. With her, we have discussed the consequences of formula milk, why we should encourage breastfeeding, why we should avoid milk mixes and gummies, and also spoken about ORS and how it can save a child's life. This and much more on this informative podcast, which I'm sure you'll find helpful. Hello, ma'am. Welcome to Decoding Health. You have
Hello.
been like a warrior of sorts on social media, and that's what we need today because of so much of misinformation. I love your reels because you're constantly trying to correct all the misinformation that's out there being spread by unqualified professionals. So, with this podcast, my hope is to bring out all the authentic scientific information, why we say things that we do, so that parents know how to best take care of their kids because this is for the betterment of kids' health at the end of the day. So, ma'am, let's start with formula milk. What all are the ingredients we should look for in formula feed? What is it that we should avoid, and so that we can better educate the mothers to make better choices?
How much ever we support the parent, the mother, the family, sometimes invariably some of the moms may need to give formula to their babies. So how do they select their formula? First thing is based on whether the baby is preterm or term for the first formula. Then the follow-on formula from 6 months of age. So according to the age of the baby. The toddler milk or growing up milk formula is not actually recommended and is not necessary. Second thing is based on the type of protein. So we have a formula based on cow's milk protein or the goat's milk protein is the one you start with. There are specific indications for soya based formula. So I'll come to that. Then the third thing is it a complete protein, partially hydrolyzed protein, totally hydrolyzed protein, or amino acid based formula? So a baby who is tolerating this formula with complete protein will stick to that. If the baby is not tolerating, having more colic, constipation, we go for partially hydrolyzed protein formula. Then if the baby is having severe eczema, severe rash, not tolerating this formula at all, then we go for extensively hydrolyzed formula. But if the baby is developing severe anaphylaxis, severe allergy to cow's milk protein, say, then we go for amino acid based formula. So why not shift to goat's milk formula in case the baby is allergic to cow's milk formula? But we have seen that, if the baby is allergic to cow's milk formula, there is very high chance that the baby will be allergic to goat milk too, and even soya milk too, to a good extent. So the other thing is lactose tolerance. So if the baby is lactose intolerant, then again we may have to go for soya based formula or low lactose formula. So how do you prepare low lactose formula then? Because this formula we add sugars, right? Lactose is one of the sugars, and in low lactose formula we may have to add maltodextrins or corn based, cornstarch, corn syrup based ingredients. Why? To make up for the energy needs of the baby.
But they are not harmful, or is there a limit up to which it should be used?
So most of these are very well regulated, this formula, okay. Whatever is needed only will be added. We cannot do without adding easily digestible carbohydrates. So the existing fear about we are telling parents not to introduce added sugars till second birthday. so that children don't develop cravings for sugars. But here you can't extrapolate that logic to formula milk at this point, because they have to make up the calories, the protein, the fats with the best possible combination that they can.
Ma'am, any brand names that you can give out which you feel are good, well researched, and scientifically formulated formula?
Most of the standard companies, they are available. Say for example, I'll take the example of Similac. A regular formula, Similac Advanced. Closest to breast milk, 360 degrees, some total care or something is there, but I don't think it's widely available. Then when it comes to a situation where I want to use partially hydrolyzed formula, Similac Pro Total Comfort and Enfamil Gentlease is there. So I want to use an extensively hydrolyzed formula. There is the Similac Alimentum and Enfamil Nutramigen. If I want to use an amino acid based formula, what we have in India are Aptamil Pepti and Neocate. If I want to give a low lactose formula, Similac sensitive, Enfamil sensitive. If I want to give a lactose free formula, we have Isomil. My experience with formula is very limited because most of the mothers who follow up with me, they exclusively breastfeed their baby till 6 months. Almost, I would say 95 to 98%, and most of them go up to 2 years and beyond.
Okay, so this is a good segue to the most important part of infant care, that is breastfeeding. So how do you encourage mothers to breastfeed? I feel sometimes mothers tend to give up too quickly. They feel that the supply is not enough, the baby is not satiated. So just a little bit to tell mothers to not give up and how they can be good at breastfeeding.
I think I beg to differ there. Moms don't give up. People around them make them give up. The support system. Moms want to. They want to nurse their babies. They want to. Some moms to go to the extent of being stubborn about it also. So how do we do it? First, prepare them. Prepare them and prepare the family about what to expect. There is any problem like inverted nipples, flat nipples, correct them before the delivery. Guide the mother about it and tell them what to expect. The first 2 days, it's only colostrum, a few drops each feed, not more than a teaspoon. And later, during the transitional milk phase only, the milk supply increases. They have to understand that. And the hospital also, there cannot be, the moment there is a little bit of like, oh, I'm not comfortable, immediately the formula is readily available. The support system is not really good, and lactation specialists are also there only in few hospitals, and not everybody is being very patient with the mother and ensuring good latch. They are this overdiagnosis of lip ties and using nipple shields. See, I also have guided parents about nipple shields way back. And with experience, we have learned that that's not the real way forward. Ensuring good latch, being with the mother, helping, ensuring good positioning, and supporting her morally, encouraging her. These are the things we have to focus on. If we do it and the family supports the mother instead of saying we used to get that much milk, you are not getting any milk, this kind of thing, then obviously mother will be demoralized. She wants to do it, but she needs that encouragement and support and proper guidance. Proper guidance. So like with experience now I know ensuring good latch and good hold and telling the mother that okay, this is what you expect. This is how you monitor. You don't have to pump once in a while and check whether you're getting enough feed or not. You have to monitor your baby's pee count. You have to see whether your baby is sleeping well, whether your baby is growing well. So this is what we need to see.
Yes, you're right, ma'am. I think it's not the mothers, but the support system that is not strong enough in our society. What happens is, as soon as the baby cries, especially if they cry at night, and even after feed, if the baby is not soothed, then immediately it's just accepted or assumed that it is because the breast milk is not enough or the baby hunger is not satiated.
Yes.
So then instantly formula milk is started.
See, formula milk is a trap. Mother's milk digests very easily and baby gets hungry faster. Formula milk takes time. Okay, that is one thing. Then second thing is, especially after 2 weeks and peaking at 6 weeks, there is a phase called colicky phase, and it comes down by 3 months. So especially in the evening times and early nights, babies constantly seek the nipple for pacification because they are uncomfortable. They are going through the colicky phase. Here, what happens is every cry of the baby is assumed to be due to hunger, and the breast is offered again and again, and the baby is not happy because baby's tummy is full but baby is uncomfortable. So drinking milk again and again, baby is uncomfortable, right? So people assume that this is due to inadequate milk supply and again top up with formula, and they mess up. So you have to understand why your baby is crying. Is baby happy being at your breast, or is baby just pulling the nipple and going back, pulling the nipple and going back? So if so, then most probably it's colic or some discomfort. Baby is seeking the nipple only for pacification. So find other ways of pacifying the baby. So you have to understand the problem properly and guide the mother properly.
Ma'am, what are few ways in which we can soothe the baby if they are having colic?
First is understimulation, like not speaking loud and like that they do, right? In Indian system, many of them like are doing the rattle with loud sounds, hitting on the wall, clapping. So those loud sounds will actually irritate the baby. You have to be very soothing, very calm. You can use white noise, you can use some pleasant music. Understimulation, being very calm and sober. This is the most important thing. And if the mother is not able to handle it, somebody else needs to take over and give the mother a break. Okay, because if mother panics, obviously it is going to reflect on the baby. You can give a gentle, nice bath. You can relax the baby, hug the baby. These are the things you can do.
Also, ma'am, when there is reduced milk supply, what are some of the things we know that there is a positive feedback mechanism, and the more you feed, the more breast milk gets produced. But what are other things that you can do in order to increase breast milk supply?
Milk supply means mother has to be confident, relaxed, and free access of the breast to the baby. That's it. And obviously, she has to nourish herself well. So, all these things like, some medicines that we give to improve the milk supply, many of them are Ayurvedic. And I must say, I would also have suggested, mostly they act as placebo. And of late, after my conversations with certain lactation specialists, then I realized I've been suggesting them, though for short courses, without realizing that the contents, if taken for prolonged periods, can even cause diuresis, can cause hypoglycemia, hepatic damage. So I've taken this call that I won't prescribe these from now onwards. That's for sure. Though we have given only for short duration as placebo, long term use is not recommended. Okay. And there are certain modern medicine medications, as you are aware of, which can increase milk production. But remember, unless the baby is nursing or unless the mother is pumping the milk, even these medicines may not help much. So there has to be a demand for these medicines to act also.
Yeah, so basically, it's the feedback mechanism that we have to mostly
Feedback
rely
and
on.
being relaxed and being confident and having good support system and good encouraging partner and encouraging family and hospital system.
Anything in the diet that you feel particularly nursing mothers should include or exclude? Anything in the
Eh,
diet?
So we see that most Indian moms are made to eat only ribbed gourd. This what is the other one? Bottle gourd with very limited salt, absolutely zero chili, and with lot of garlic. This is what they're forced to eat, and they're not allowed to eat even dal because they're worried that the sutures are going to get pus. Okay, and they're not allowed to eat oranges and guavas because they're worried the babies will catch cold. These are all myths. The mother can eat happily pleasant food which suits her. So she has to avoid very spicy food, food colors, ajinomoto, too much caffeine, and she has to have a balanced meal. But there are certain protein allergens. Common allergens are nuts, peanuts, soya, egg white, wheat, dairy, seafood and fish. If she has observed that, okay, I've eaten this particular food, only today my baby is very cranky or tomorrow my baby is very cranky, then maybe she can avoid that food and observe. Or if the baby develops rashes or some gut disturbances, then she has to definitely check with the pediatrician and then plan accordingly. But there is no blanket rule to avoid any food.
Okay, yeah, this is a very common myth that mothers have. Actually, when I was breastfeeding, also I was told, to avoid certain things and that it would cause a little bit of stomach upset in the baby. But it's not that. You have to eat a nutritious diet, and also during lactation, you're very, very hungry. So I think the calorie intake also has to be higher.
It is higher, 550 calories more than what she was eating prior to conception.
And also, ma'am, what do you think about these laddus that you are given, which is very high in ghee and nuts during postpartum period? Does it actually help?
See, nourishment. So obviously, like you nourish yourself well, the quality of milk that you give to your baby will be good. And you'll also be happy. But if you don't like it, you have an aversion for it, you should not force yourself to eat those. But you have to figure out other ways of getting similar nourishment. And second thing is, okay, we'll take this poor woman. She has no access to these laddus or any good diet. She lives in slums. She can't give formula to her baby, but she'll be able to breastfeed her baby very nicely without any problem. Why?
Because
She has
she's
no
persistent.
options.
Yeah.
She has no options. So she's not looking for alternatives. Baby is demanding, she is feeding. But quality of milk may be not so great. So it comes to this.
Ma'am, you feel that these tongue tie surgeries and all have increased in the past few years, or what is the reason
Very
for it?
much. Tongue tie surgeries and lip tie surgeries. Very much. One is more awareness, the other is overdiagnosis. Okay, so let's take lip tie. Lip tie, if it is severe, there are 4 grades based on how anterior it is or how posterior it is. So, if it is severe, obviously it will affect the latch and it may affect the speech, it will affect the oral hygiene, it will affect the development of the jaw, okay, and so indirectly it will affect the dental caries and all, maybe more, because it will affect the cleaning of the mouth. So if it is severe or moderately severe, definitely we need to intervene based on the indication. And after doing the tongue tie release, the support given later is also very important. It's not done like I do the surgery and I'm done. So the lactation part, the speech therapy part, everything, good support needs to be given. And coming to lip tie, again, there are 4 types. Mild, then it's to the gingiva, in between the teeth, and deeply in between the teeth. So then again speech may be affected. Say lip tie is the p, 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 b, b. These letters will be affected, right? And air swallowing may increase when baby is feeding. Choking episodes may be a little more with tongue tie. Okay, so based on whether it's really indicated or not, we need to intervene. Okay, so what's happening is awareness has increased, but overdiagnosis also is happening. Because in my experience, I've helped so many mothers where for minor lip tie, they were referred to the pedodontist for releasing the lip tie. Whereas I just had to sit with the mother for half an hour and help them with the latch. And absolutely, these kids are not having any problem either with the speech or they never had problem with the latch later. So I advise parents, if somebody advises you to do a release, please take a second or third opinion before you proceed further.
Okay. Ma'am, since we're on the topic of breastfeeding, what do you feel about working mothers and breastfeeding? How to navigate that situation?
So again, like suppose I'm joining work after a month, right? So let me start planning right now. Let me simulate. Okay, I'll be joining in a month. So how do I plan it? When do I pump? How do I store it? Read up about the guidelines. How do I warm the milk? And do I use bottle or paladai or spoon bottle? How do I give? Who will give the milk? Who will be the caretaker? Taker? Let me teach them how to do it and start that process right from maybe 1 month before only. So they can. But if it's becoming too stressful for them, then they can discuss and they can take a call about topping up with formula. That's a personal choice. And these working moms, when they are in their offices, if there are rooms for them to pump milk, they can do it. But if it is too much of a hassle, then they have to just go to the washroom and release the milk. Otherwise, engorged breasts and again breast abscesses and all that will be an issue. So I think planning, understanding the guidelines, and having a trusted caretaker to do it, delegate the responsibilities properly, and start off at least 2 weeks to 1 month before.
Ma'am, for ideally, how long should you breastfeed?
Exclusive breastfeeding is first 6 months, 2 years and beyond is what WHO says. Okay, it's between the mother and the baby. They will decide. Okay, but there are certain concerns being raised by pediatric dentists, periodontists. This kind of feeding is increasing the risk of caries. But no, the way the baby breastfeeds, baby takes the milk and drops it back. The milk doesn't touch. So good oral hygiene is very important. Or if the baby is sleeping with the nipple in the mouth, so constantly there is a little leak of milk into the baby's mouth, that can predispose to caries. But proper feeds, where the baby is feeding and the feeding is done, that is not going to predispose to.
Now, I want to talk about a few common myths about breastfeeding. A lot of people feel that if you have small breasts, you cannot breastfeed.
Oh, that's a total myth. Total myth.
So it's not the size of the breast at
No,
all.
no, no.
We all have that feedback mechanism. As long as you feed, the milk will get produced.
Yes.
Also, a lot of mothers don't want to breastfeed because they feel that it leads to saggy breast later.
Complete myth. Complete myth. Complete myth. Not at all.
So they should breastfeed irrespective.
Should, I won't say, it's the mother's personal choice, but it's a myth.
Breastfeeding should be stopped if the mother has fever.
No, not at all. Not at all. In fact, some of the antibodies may go in and help the baby. But if she has cough and cold, better wear a mask. Follow good hand hygiene practices. And there are certain conditions like HIV, tuberculosis, chickenpox, where I think I don't want to confuse the audience here. It has to be decided after a one-on-one discussion with the doctor.
And ma'am, is there any studies to prove that breastfeed children have higher IQ?
There are many studies which say that they have higher IQ, but I think that shouldn't deter a parent from offering formula milk if she feels she has to do it, and no, their IQ is not going to be low.
Yes, because a lot of mothers do fear, they are not able to produce the milk, but then they do want to give formula thinking about all these. But yes,
Yeah, there are
stuff to do.
risks. See, formula milk, then bottle, there is increased risk of allergies, asthma, increased risk of infections, and we have to, increased risk of diabetes, obesity later in life. But we have to make the best out of best of what we have, right? So if I am forced to give formula to my baby, I'll select the best formula. I'll do it in the best possible way. And once I start complementary food, I'll do it in the best possible way. Homemade food, I think things will fall in place.
how to soothe a mother who's suffering with guilt that she's not able to breastfeed?
Oh,
How do you
never
support?
feel guilty, dear mom. Okay, every mom does her best
Yeah.
for her baby. Never question yourself. You have done your best. You have done your best and just keep going. You're the best mom for your baby.
Ma'am, diarrhea and vomiting are very common conditions that a child goes through, and whenever they have it, the first thought the parent has is what medicine to give in order to stop. But the most important aspect is hydrating the child and giving ORS or oral rehydration solution. So, a little bit on that. What is the principle behind ORS? And you have been a warrior of sorts, encouraging mothers, parents to give the correct ORS solution to the baby. Why is that important?
ORS is 20th century wonder drug. Saved millions of lives. Or even when you have typhoid or dengue or anything, you're not taking liquids, and even in dengue you get dehydrated, you have to correct the dehydration. You're having vomiting, you have to correct the dehydration. But when you have persistent vomiting, obviously you can't tolerate the ORS. I'm talking about vomiting where when you give sips of ORS you can still tolerate it, okay? Right. So you get dehydrated and you have to replace the liquid lost, the fluid loss. You have to replace the electrolytes lost. So WHO recommended formula ORS was formulated keeping in mind adequate replacement of fluid and the lost electrolytes without worsening the diarrhea. So that's why earlier the osmolarity was 311 milliosmol per liter. Now it is 245 milliosmoles per liter, and they have seen better results with this. So here it is based on this principle, the glucose and sodium co-transporter. So there's 75 milliequivalent per liter of glucose, 75 milliequivalent per liter of sodium. They go together and then pull the water along with them, right? So when you give more sugar than this in the formula, that sugar is going to pull water from the gut into the lumen of the gut, from the body into the lumen of the gut, and the diarrhea is going to worsen. And why am I fighting for it's been almost like 8 years, 8 to 9 years. There is this thing called ORSL. What they did was they named it ORSL. So 75% is ORS there. They have taken permission from FSSAI. And everybody started believing that is WHO recommended formula ORS. And everywhere in medical shops, in hospitals, everywhere ORSL, ORSL, ORSL. And when we realized that the diarrhea was getting worsened instead of improving and the hospitalizations were increasing, then when we got the Tetra Pak and so, we realized that it had almost 9 to 10 times the sugar. And that's how I started raising awareness about it. Then later a small disclaimer was included on the back of the pack. This should not be given during diarrhea. Nobody is going to read the disclaimers. And later on, we persisted, and from 2021, I've been writing to the health ministry, the CDSCO, the FSSAI, and on 8th April 2022, they have issued an order saying these companies should not use ORS on their labels. By then, Ribalance with ORS also was in the market, ORS Fit was in the market. Now even Glucovit Active ORS is in the market. And there are certain other drinks like Zincovit Active, Himalaya Rehydrate, Electro Choice, though they don't have ORS on the label, but they are being sold as ORS in the pharmacies. So we were happy that okay, finally an order had come, but in 2 months the order was reverted. In July they said they can put a disclaimer on the label, this is not an ORS, and sell it. So now if you see latest from 2022 August, you will see a disclaimer, this is not an ORS. Later on this Kenvue company, this is basically from Johnson Johnson only. So what they did is they've launched one low sugar product containing stevia. Stevia itself causes a little bit of bloating, right? And moreover, stevia is not going to work on the same principle as sodium glucose co-transporter. So it's also not an appropriate liquid for rehydration. Anyway, I filed a public interest litigation in Telangana High Court in the same year. The final hearing is pending. I mean, how much can one person fight? I'm trying my best to raise awareness, and so many doctors have come forward in support of this. But this is not enough. Government has to bring in this regulation. ORS means only WHO recommended formula ORS. You can't use ORS. You can't sell any other drink in the pharmacies. Not these high sugar drinks. No.
That 3 letters ORS should be banned.
Even other drinks where they don't have ORS on their labels should not be sold in the pharmacies, in the hospitals, should not be prescribed, should not be sold in the schools. It endangers lives of children and adults. I've shared a post, one child with diabetes, and the mother thought, okay, dehydrated, they kept giving ORSL, ORSL, ORSL. And that child landed up with diabetic ketoacidosis. And the argument these people give is, we are not promoting it as ORS, we are calling it ORSL. We have a disclaimer. Is that a fair enough argument?
Of course not.
Huh? We all have to come together, and if any pharmacy is selling these drinks as ORS, stop going to those pharmacies. If any doctor, any hospital is giving you this, question them. People have to raise their voice.
Yeah.
Even with milk mixes, doctors, pediatricians, gynecologists, oncologists, how can they even endorse them? And they are even misleading parents, saying that these are the ones which will improve the height of your child. Just few days back, a mother messaged me, her 14-year-old child is telling his friends, I didn't grow tall because my mother didn't give me Pediasure. Tomorrow, so many children will say, I didn't grow in height because my mother didn't give me Gridzo Super Milk. Because they are advertising saying for children's height, these are the things we need to give. Height is predominantly determined by genetics. And there are certain causes of short stature. So I have a syndrome, I may be short. I have a hormone deficiency, so many hormones, okay, growth hormone, thyroid hormone, I may be short. And there are other causes, familial short stature, genetics, right? And constitutional delay in growth. So after some time, they will reach their height potential. I'm chronically malnourished. Then it's not just height, weight, everything. I'm stunted and I'm wasted. I overload you with too much of these milk mixes and all. Then I will not only grow in height, I'll grow in weight also. I become obese.
Ma'am, what do you think is the way forward with milk mixes? Should they be banned completely, or can we make it healthier? Is there any way to regulate them?
Milk mix cannot be something which should be promoted for children. There are no shortcuts to good nutrition. If there is malnutrition, temporarily if the pediatrician feels this child needs something additional, temporarily, maybe, that's it. Not as a generalized rule. You have to work towards your children having healthy diet. Don't take shortcuts and get them used to shortcuts. This is going to have lifelong impact on your children. Even for the teeth, they are not good. And gummies are choking hazards for children less than 5 to 6 years of age. And some of the doctors, when I made a reel about this, one gynecologist went on to say, we don't stop walking on the roads just because there is a risk of an accident. So, I mean, she's implying that you can give gummies. You don't have to stop giving gummies because they're choking hazards, it seems. I mean, what logic is this?
What are there in those gummies? It says like vitamin supplements in a gummy form?
Yes, vitamins and minerals. But the absorption also is not so great from gummies. Not.
Even in dermatology, there are a lot of these hair gummies that people take to make their hair thicker. They have the worst formulation, don't work at all. You're just taking 5 grams of extra sugar that you don't even need. And there are certain ingredients like which are deficient when you have hair fall, such as iron, zinc, and vitamin D and vitamin B12, which are not included in that gummy. Like it cannot be in that jelly formulation. So they just put biotin and then put some sugar and one or two ingredients and then sell it as something for hair fall. And the same thing is being done for kids, which is, I think, detrimental, and that should
Detrimental.
stop.
And if you say sugar free, but still it is sticky.
Yeah.
Sticky, right? And you know, when food particles get stuck, and again that predisposes to dental caries. And moreover, there's so many times when children, they like gummies, right? So secretly they eat too many. So toxicity, that's also a risk. All these have to be kept in mind. There cannot be shortcuts. You have to work. Celebrities are, they're being paid by these companies and they're advertising for these things and trying to, one celebrity said India is protein deficient, so we have to give Grizzo super milk. So how does that work? It's costly. I mean, affordable families anyway can plan good diet for the baby, good diet for the child. People who cannot afford, can they buy Grizzo super milk or any other? I mean, I'm just taking one brand's name because these are the advertisements that are coming now. Little Joyce, Grizzo, and Bonvita and all. Anyway, people already know that, you know, they should not give this. Bonvita, Boost, all these have sugar. Whereas these Grizzo, Little Joyce, Truvi, Slurp Farm, all these have jaggery. And another thing they are saying is like we are sugar free. And when we started objecting, now they are saying we don't have refined sugar. See, body doesn't differentiate between jaggery and sugar. Sugar is sugar. It works the same way. Maybe a little extra iron in jaggery, but that doesn't mean you can just pump your, give loads of jaggery to your child. I mean, there's a lot of deception and misleading marketing going on.
So, ma'am, as a parent, how can we encourage our child to eat healthy, and what are good protein sources for a child?
So, you start off from the beginning. First is infant responsive feeding. Start from there. On demand feeding. And when you start complementary foods, be patient, expose your baby to foods as per the guidance given. Ensure that by first birthday your baby is eating from the family pot. Encourage self-eating, self-regulation from day one. And children imitate you, the parents. So they emulate you. So you set an example. Okay, doctor, I haven't done all that. Now my child is very fussy
like
with
as a
eating.
5-year-old child who's a fussy eater.
Yeah, what
can
do
we
I do now? I've crossed that. I've used TVs to distract and feed. Distraction feeding is also force feeding. So don't get into that. Okay. So you start well from the beginning. Now that I've crossed. Now my child is 5 years. But it's never too late. Again, start working from basics. You sit with the child. You explain to the child. And let him eat how much ever you can. Your duty as a parent is to plan the quality. Quantity, let the child decide. And like say, okay, today you eat broccoli, I give chocolate at the end of the day. That doesn't work. That's bribing the child. You eat broccoli because it's good for you. So I'm eating. Persist, persist, persist. It will pay. Be consistent. Explain. If there are any deficiencies, temporarily you take the pediatrician's help and cover. But persist with consistency. Your eating habits have to be good, and persist with explaining to the child why you're offering this food, why you're offering this food, why it's important.
Ma'am, there's a lot of talk about avoiding sugar. So, is there a safe limit or the amount of sugar that we can give to a child?
The latest guidelines are don't offer added sugars till second birthday. That includes sugar, jaggery, honey, etc. Because and avoid offering flavored milk at least till fifth birthday. Why? Because if you introduce these things early, the child is likely to have cravings and it's likely for a habit to form. Okay, so we don't want that to happen. It's not like we don't want children to eat sweets. Once in a while, an indulgence is definitely needed and acceptable. It becomes a habit. The child cannot stay without a chocolate every day, without a biscuit every day, without a milk mix in his milk every day. In the long run also, this child will be likely to deal with obesity, diabetes, PCOS, so many problems. So, and also there is a limit after second birthday. The limit that is being said is maximum 5 to 6 teaspoons of sugar. Sugar means jaggery sugar, whatever. Okay, all added sugars. But I would say keep it a little lower also. So much so that, like, basically simple. Don't let your child get into craving for sugar every day. That's very important.
Ma'am, what are like good, healthy sources of protein, vegetarian sources of protein for a child?
Vegetarian or vegan?
First, let's do vegetarian and then we'll do vegan.
Okay. So, vegetarian. Vegetarian, then I think even milk, curd, paneer, and soya, nuts, legumes, all this rajma, chole, lentils. So a little bit of planning will be needed, but you can still do it for the children. When it comes to vegan, it becomes a little more tougher, but I know of parents who plan it very well, and for them I think they use a little extra soya. But the problem here is if the child is allergic to soya, that's one problem. And some studies are saying that phytoestrogens in soya may be responsible for precocious puberty, but the evidence is not strong. So,
is there any amount of soya that you should stick to? Any, like, nothing like?
So there are many cultures they do eat quite a good amount of soya.
Yes, like Asian meals usually are a lot of soya in them.
Yeah, so there is not enough, like, it's not strong. The evidence is not strong, but good amount of planning is needed. Whatever I've said about vegetarian foods, if you remove the dairy from there and automatically the remaining foods, but it needs good planning.
If it's a non-vegetarian family, at what age can chicken or any of those non-vegetarian sources be introduced in the child's diet?
Chicken can be introduced once you start solids actually. Slowly introduce rice or whatever the family's staple carbohydrate is, easily digestible form. Then you introduce the lentils, then the eggs, slowly, step by step, ensuring baby is able to digest it well. Then you can start chicken. So that's not a problem at all. Even in families where children are getting adequate protein through diet, 14-year-olds, 15-year-olds, 16, 17, they want to use protein powders. It is allowed from 14 years of age, but not before that. We don't have enough long-term studies for using protein powders.
What is your take on protein powders in kids in general? People who are not deficient or let's say fussy eaters who are not.
It is not only about kids, even about adults. We better stick to the guidelines and take balance is important. Take appropriate amount. Don't overload, don't deprive. We have guidelines. Like from 1 year of age, it is 1.05 to 0.85 gram per kg body weight per day. The 0.5 is for adolescents. But if they have good amount of activity and all, we can go up to 1.5 gram per kg per day. If they are into competitive sports and all, they are saying it's being, not me, the guidelines say you can go up to 1.8 gram per kg per day. And another misconception is that only eggs and meat have protein. It's not like that. Rice also has certain amount of protein. It's just that the carbohydrate is dominant. So when you do your math, see how much protein your child is getting or you are getting, and try your best to keep it within the recommended guidelines. Even as an adult, unless you are you are into competitive sports or into bodybuilding, then obviously your sports medicine can consult a sports medicine specialist, sports nutrition specialist, nephrologist, keep them in the loop and take guidance from them. But a regular person who is having moderate exercise, I think it's better not to go beyond 2 gram per kg.
Are there any particular protein powders that you feel works well, whether it's like whey protein or you think vegan sources of protein powders are better? And what do you
I'm
think
not
about the
an expert
regulation?
on protein powders,
Mm.
but you all know that recently there has been a very big study by liver doctor and a group of people. They have shared the information very well on social media. Maybe those who are interested in protein powders can refer to that and ensure they pick a protein powder which suits them. For example, if I have lactose intolerance, so I wouldn't pick
Whey protein,
whey
yeah.
protein,
Mm.
even if it is an isolate or something. Still there may be some contamination with lactose and all,
Mm.
right? And I would see that there is no melamine. I would see that it meets all the safety regulations. I would like to see that it doesn't have too many added sugars, huh? And too much of artificial sweeteners. So all these things I would like to
Mm.
see the cleanest possible,
Mm.
no heavy metals. Yeah, I'm not an expert on these whey proteins, but you can see this data done by this amazing team.
Yeah, I also share it with the patients whenever they ask me for brand recommendations.
Yeah,
I tell them to go through
I mean,
that.
we can't be experts on
Yeah.
everything, right?
Ma'am, because of this whole social media movement, a lot of people are using rock salt, pink salt, thinking that that's better in their diet. That we know is leading to iodine deficiency. So, what has your experience been with this?
So our daily requirement of iodine is anywhere from 90 microgram per day to 200 microgram per day. The pregnant women need it more, the 200. Most of the salts, iodized salts, have 15 microgram per gram of salt. And the maximum recommended salt for an adult is 5 to 6 gram per day, and maximum recommended sodium is 2.3 gram per day. So even if I take 10 times the recommended amount, 10 times. So 1 teaspoon of salt is going to give me how much? 90 microgram. So only if I take 6 to 10 times the recommended amount of iodine, that may become a problem for me. And there are certain conditions which I can't discuss here, endocrinological conditions or oncological conditions, where we can't give extra iodine. There they have to discuss on a one-on-one basis with the doctor. Iodine is definitely necessary for thyroid health, and if you take the recommended amount of salt, if you don't go overboard, then it is not going to harm your thyroid gland. But if you eat the recommended amount, it is going to be beneficial. Now we have definitely less cases of hypothyroidism after government has put in this regulation that all salt has to be iodized. So but people are getting misled by advertisements about this Himalaya pink salt. I think Tata pink salt is iodized. Himalaya pink salt, that it's better for blood pressure control. How is it better for blood pressure control? Whether it's pink salt or iodized salt, the sodium
Sodium
content
content is
is
the
the
same.
same. So how is it going to do anything? Okay, it has some extra minerals. We get that through our food and everything. We don't need that extra minerals and pay so much money for that. We have to take iodized salt. You want to take pink salt or you want to take white salt, but please take iodized salt for.
Since we want to correct as much misinformation as possible, there's a lot of misinformation about autism and vaccine and how vaccine administration is leading to autism. This is actually in the US, the resurgence of almost eradicated diseases. People are having encephalitis due to measles.
Measles.
So, because they are avoiding
No,
measles
we are going to
vaccination.
see that very soon in India
So,
also.
let's just correct this misinformation that is there any relation between autism and vaccination?
No. No means no. Very clearly. But people are fear mongering. This is saying that there was this video circulating. These children received vaccine at 5 years, it seems, MMR vaccine, and suddenly autism appeared. Autism doesn't appear suddenly. Maybe it was diagnosed at that age, or that video was created deliberately, and it is disinformation. I won't even call misinformation, disinformation. So dear parents, please take guidance from a qualified child psychiatrist, child psychologist, or a developmental pediatrician. Please And early intervention is very crucial. Stick to therapy. This is most important. This is most important. And stem cell therapy, please don't throw your money to them. It is not even legal at this point. It is not even legal.
So as of today, there is no oral medication or nothing, no injectables that you can take for autism. It's only speech therapy, behavior therapy, training that you'll have to do with a psychiatrist and a psychologist in order to improve the
And
child's.
other thing, the therapy centers also, some of them, the latest guidelines clearly tell us that involve parent. And I know of centers where they don't let parent at all inside. The parent has no way of knowing what's happening inside, and the child cannot communicate to the parent. And I know of a couple of instances where the child came out of the room bruised, but the mother had no way to know what happened inside, because the therapy center was refusing to give access to the CCTV also. Very bad, very sad.
Unfortunate.
Parent has to be allowed.
Ma'am, so I've seen your Instagram posts about CPR and first aid for choking. Why is it important for everybody to know? And what do you think are the best sources through which they can learn the best way to give CPR in choking?
6 out of 10 deaths can be prevented by giving the right first aid at the right time. And in India, hardly anybody knows CPR. So, according to me, every parent, every teacher, everybody in public, in public service, be it at the malls, be it at the airports, be it a taxi driver or an auto driver, all of them need to know the basic first aid, especially CPR, and when not to do certain maneuvers in CPR. Every parent should know first aid, every teacher should know first aid, every school staff should know first aid for choking and seizures. Choking is the single most common cause for accidental death in late infancy and in toddlers. So prevention is extremely important, and then knowing first aid also is extremely important. I'll give you my own example. While I was doing my residency, pediatric residency, I choked on a gooseberry seed. My house surgeon gave me Heimlichs, like he came behind me and gave the first aid maneuver, which we call as Heimlichs, right? And he saved my life. I don't know why I started doing this, but from the time I started my practice in Hyderabad, I started focusing on teaching parents about first aid and CPR. I started doing workshops, and I have personally trained more than 20,000 people so far, not just parents. It's also teachers, school staff, ASHA workers, and some farmers, some housekeeping staff, drivers. I've trained many people, and I've created so many videos, and I've encouraged more doctors to come forward. And now some of the doctors have started CPR training programs in Chhattisgarh, in Pondicherry, in Tamil Nadu, Uttarakhand, in Punjab, whoever, I've sent mannequins to them also, some of them. They've started now. And this has to be a revolution. Revolution. Every nook and corner of India, CPR training has to start. Has to start. At least chest compressions. We call it calls. That at least has to start. Watched news about a child choking on chapati and dying, about a child choking on a chocolate and dying.
Even these jellies, jello,
Gummies.
yeah.
It's not fair. It's not fair. These are preventable accidents. First of all, we'll teach our children to focus on eating when they are eating, not watching TV or laughing and, talking with food in the mouth. And second thing, let us all be trained in first aid for choking. And recently, you must be seeing videos about this apparatus where, which uses the principle of suction to protect us from choking, from choking related deaths, but this is not approved by any society, any first aid society. There are only anecdotal reports, okay? If you don't use it properly, in fact, it can push the foreign body further down. So as of now, at this point, we have to follow the guidelines, whether it's infant choking or choking in children or choking in adults. So I don't think I can teach them now about that, but you can see Red Cross guidelines. You can watch Red Cross videos, St. John's Ambulance videos. My channel is there, Dr. Sivaranjani's Easy Health. And in India, for seizures, they usually keep a key in the hand or put a spoon in the mouth.
Oh.
That is to be avoided. Okay. Seizures means you just make sure the scene is safe. And once the seizure passes away, remove whatever is there in the mouth and turn the person to recovery position. This is the first aid that needs to be done. And choking, many people go and hit on the head or offer water. You may in fact choke the person even more. If a person is coughing, let the person cough. And if somebody is indicating to you like this is called universal choking position. Go and be there to help. If the person is coughing, do not disturb. If the baby is coughing, do not disturb. Only if they are not able to cough, they are not able to produce any sound, or if they are making a sound like this, then you go and help. Okay, so watch these videos, be thorough with the first aid, please.
Yeah, that is very important now. We all should learn it. Now there is a lot of material online that we can learn
Yes,
from, and
yes.
also centers which teach this.
Yes.
So definitely a skill that we all should have.
Drowning.
Mm.
Drowning again, please, every school, they are having now swimming classes. They have to have enough people to keep an eye on every child. Every parent should have his or her eye on her child, always. And in movies they show, near drowning victims being taken out and the tummies being pressed. That is a very wrong thing to do. That's a very wrong thing to do. The guidelines, whether it is near drowning or any other cause for unconsciousness, the guidelines are same. We have to follow the guidelines. We have to know the CPR, and we have to know when not to bend the neck, when not to turn the person. There are certain guidelines. You have to be thorough with them.
And one more topic I want to just touch upon is vaginal and cesarean section deliveries. There has been, a lot of talk about why in India or in South Asia we push so much for cesarean section deliveries, whereas in the West everybody is having normal vaginal delivery. So this whole thought of your people are going more for cesarean section, maybe because of astrological reasons, maybe they feel that the child has to be delivered on a particular date, or mothers being too scared about going through labor. What is it that you feel needs to change so that we can give birth as naturally as possible? And also, has this pendulum swung the other way, wherein doctors are trying to go more for vaginal deliveries even when cesarean is required?
See, there is good and bad in every profession, right? When cesareans were more, my observation is, one is, as you said, for astrological reasons, the family would put pressure on the gynecologist, which ideally the gynecologist shouldn't oblige, especially if the baby is not ready, baby is not mature enough. But beyond that, I don't think I have the right to comment on whether the obstetrician should oblige or not. So I don't know, to be very frank. Okay, second thing is, I want to finish the delivery. I don't have the patience to wait. That may be one reason. But as I said, most of my gynecology friends don't do this. But there are some people, like in every profession, there is bad in our profession too. But we can't generalize. We can't generalize. The other reason may be why cesareans were more. Maybe people don't reach on time till there is fetal distress or something. Maybe they don't go for regular checks properly. That may be the reason. One is this astrological reasons, and one is maybe the gynecologist wants to finish her work fast. The other is maybe people don't go for checks properly and they land up in the emergency all the time. The other thing is maybe the financial incentive, maybe. But as I said, this is not the case with everyone. There are a selected few who would have been doing this with this bias. Okay, but now we are seeing a different trend. Firstly, I take a strong exception to this nomenclature, natural or normal delivery. Okay, because once you say vaginal delivery is normal delivery, then is cesarean abnormal delivery? Like you're already judging the mother. No, it's not fair. Deliveries are 4 types: vaginal, assisted vaginal, cesarean, and vaginal birth after cesarean. This is what. And each mother is different, each situation is different, and there will be indications where you have to do cesarean. There will be indications where you have to do assisted vaginal delivery. So you have to take a decision based on what is good for the baby and the mother for the best possible outcome. But what's happening now is, because of certain social media viral posts about the so-called natural deliveries, so-called normal deliveries, it's become a fad now. So the parent is also getting obsessed with having vaginal delivery at any cost. Let the gynecologist do what is best in that situation for the baby and the mother. Don't be fixed on anything.
Ma'am, has there been any experience that you remember that has left a mark, where you feel that the patient care that you gave could have been a little different? Any kind of mistakes that you've made that now you learn from and you want others to not do it?
There are two I still didn't get a closure on. One was this child. She had a primary immunodeficiency disease. She presented with sepsis. We started high-end antibiotics only. In spite of that, the child deteriorated and passed away. Maybe even higher antibiotics I should have started, or had there been an immunologist at that time, maybe we could have taken their inputs and done something better. Like that, it traumatizes me many times, and there's nothing I can do now about it. The other thing is, I was the HOD. Right now, I'm only doing private practice and an independent practitioner. At that point, I was heading the department, and there is this preterm, and baby was doing well, and the parent wanted to be the baby to be shifted to the room because of financial constraints. We shouldn't have done that. That was the first mistake. And there was a team of 2 neonatologists and 2 intensivists who were covering the baby round the clock. The baby developed a kind of skin rash in the perineal region. The team thought it was due to zinc deficiency and were managing accordingly, but then the baby developed florid pseudomonal sepsis and didn't respond to the highest of anti-pseudomonal antibiotics and succumbed. I haven't seen the baby directly, but the father did bring to my notice at one point that the nurses are not following the protocols properly. I spoke to the nurses, but every time I think maybe I should have gone there, I should have seen the baby, maybe I would have picked it up. Maybe we could have started, realized that it's sepsis and not just zinc deficiency that's happening. I feel very guilty, and I don't think I'll ever get a closure on that.
It's a difficult profession to be.
Yeah,
Pediatrics,
I
because
mean,
you're
there is no willful negligence. maybe, or maybe I wouldn't also have made any difference. Maybe I also would agreed with their diagnosis.
This is the topic I want to bring up because, when we spend, let's say, 5 minutes or 10 minutes with the patient in terms of evaluation, diagnosis, and treatment, people sometimes argue that, oh, you're charging so much fees for just 5 minutes of your time. You barely spoke to me for 5 minutes, or you barely examined me for 2 minutes, but still your fees are exorbitant. It actually reflects the years that we have spent into learning, years into training, then constantly trying to upgrade our knowledge, become better, give the best patient care that enables us to make that diagnosis and give that treatment in 5 to 10 minutes. So, what do you have to say about how healthcare professionals are perceived in India? I feel here people do expect a lot of free treatment, free advice, free consultations at all times, and do tend to call us, greedy when we say that they have to go through a proper route and consult us. But it's not just about the monetary gain. It's like, we have to examine them properly, evaluate before we prescribe anything. Otherwise we are just doing something off the hook. That's not going to differentiate us
How
from
much do you pay for a
unqualified profession.
haircut, doctor?
Yes, 700 rupees. Yeah.
Okay. So if a doctor's fee increases by even 100, then why so much?
Yeah.
So see, it's the quality of service. If I feel I deserve this, I have a right to demand my fee. Those who can afford to come to me will come. Once they meet me, right, and they're very happy with the care provided, then only they're going to come back to me, right? They're going to come back
Hmm.
to me. So, so my fee is my prerogative. Okay. So I'll tell you some examples. There are so many parents who can't afford my fee, who can't afford my fee. Okay. But I waive off. I don't take fee from them. And there are many of them who I have paid for the hospitalization because I didn't want them to get lost. Sometimes 10,000, sometimes 15,000, because I'm like that. I mean, I want the child to get better. Okay, so it's my prerogative. If I waive off also, it should be my prerogative. And if I see, Constitution of India says health is everybody's right. So the government has to make sure that it provides affordable health care. I'm not sitting here to provide affordable health care to everyone. I have to first feed my family, I have to take care of my family, and as long as I'm doing it ethically and honestly and I give the correct service, my fee is my right.
Ma'am, a little off topic, but as two women on social media making content almost every single day on Instagram and on YouTube, do you feel that as women, no matter what our credentials are, in the end, it comes down to the way we look, the way we are aging, and it's a little unfair?
I'll tell you my experience. Would have realized that only on Insta I post nowadays. I've created my social media pages long before any of you are even on social media to raise awareness. Nothing more than that. If you see, none of my clinic details or my phone number, nothing will be there. I mean, I'm not able to give content in the YouTube and all because I don't have time. But somehow for Insta, I am managing. So whenever something like I feel some disinformation, misinformation is going on, immediately I just record and I post. So sometimes you'll see me very haggard at the end of the day, and I started having white hair after COVID. I'm 48 now. And there were these remarks by women only. Wisdom doesn't come with age. Just because I decided not to color my hair, just because I just dress simple and I record my videos whenever and wherever, so they have assumed me to be some very old person because I just kept my white hair. I didn't want to waste my time coloring my hair. And this color that I have done this time is not because of these people, not because I got, upset with these people's remarks. I have a lot of clarity on that. My husband asked me to color, so I colored. That's all. So I don't know why we are judged based on this looks. I think we have a right to age gracefully, and if I am giving good content, raising awareness, I think that's enough for you. Please don't comment on my
Yes,
age or my
it's very
accent.
unfortunate.
Don't make racist remarks.
It's very unfortunate, ma'am. I started making content back in 2018. I started posting regularly. So I was 33, 34 that time. Now I'm going to be 40 next month. I have aged and my skin does look different. And yes, as a dermatologist, I'm expected to look the best all the time, have flawless skin, which I don't.
It shouldn't.
Be.
You
I
shouldn't
have,
be expected to. It's not
yes,
fair.
yes, but then, I keep getting comments about dark circles, about graying, about even if I have a single pimple on my face. So yeah, it is a little unfortunate. I don't think men in this field have to go through that.
They don't have to.
Because I think a man with gray hair giving out information online is very respectable, like they have full beard which is white, and people are, oh no, he's an experienced doctor who's giving out information. But if we sit with
We
a
have
little
to
bit
look
of gray hair
glamorous even when
at
we are
all
giving
times, even when I show my gray, I have premature graying. I started graying at 27. And I have pretty much like 60% of my hair is grey. And yeah, even if I don't do touch up for about 3 to 4 weeks, I do get comments saying it's time for a touch up, which I don't think others
Who are
get.
they to tell us?
Yeah, it's unfortunate.
We have to decide what we want to do with our looks.
Sometimes I feel it's an uphill battle, because no matter how much you share and no matter how much you feel you've accomplished, or how much you want to help, we should not be reduced to the way we look at all times. Shouldn't be like that.
Not even all times. I mean,
Never.
we shouldn't. It's my wish.
And okay, ma'am, before we part, just a few things. What are the 5 things that you feel should never be given to a child?
Unhealthy family atmosphere where everybody is fighting with each other. Unsafe environment where you don't know how to prevent accidents. You don't know what to do when your child has a problem. You don't know the first aid. Unsupervised screen time. Shortcuts to your child's health. I would say even selection of school. When it comes to selection of school, putting pressure on your child to succeed academically, that also I don't agree with.
We sometimes tend to put our expectations
On the children.
And what we desire for ourselves on the child, but we have to look at them as separate individuals with their own requirements, wants, desires, and not project what we think is success on them. Their definition of success can be completely different.
You just be the wind under their wings. Don't try to be them, or don't try to make them you.
And what are the 3 parenting myths that you wish did not exist?
Picking your baby whenever baby cries will make your baby very dependent on you. That's bilkul nonsense. And spare the rod and spoil the child. That's not fair. I mean, you don't have to hit your child to to discipline your child. A mother who is taking care of herself is neglecting her child.
It's a very important point, ma'am.
We have to take care of ourselves, and we have to set a good example of balance.
Yeah. And ma'am, now before we part, 3 things you want every parent to know.
As I said, let them learn something about the right way. I mean, there is no strict right way, but learn about the parenting styles, and especially authoritative parenting. Trust their intuitions also. So get the information from right things, and good parenting. I mean, you can't be right always, but try your best. Do parenting the right way. Be thorough with your knowledge about preventing accidents and giving first aid. Protect your children from abuse.
Okay, thank you so much, ma'am. This was really informative. I'm sure it'll help a lot of people, a lot of parents out there will derive a lot of knowledge, information from this podcast. Thank you for your time.
Thank you, Anjal.
I hope you like this podcast. If you like such health-related content, do follow us on our Instagram handle, Decoding Health with Dr. Achal. And for health and skin-related content, you can follow on my Instagram handle, Dr. Achal MD. Thank you for watching.